Right, I've started your timer and here is your question. This is also one of the recall station which comes frequently with many centers. All right, so if you have read and understood, considering a history taking station, kindly please begin.
Hello, good evening. My name is Dr. Hussain, one of the exam candidate. Can I check your name and age, please?
Yes, my name is Mike. I'm 33-year-old.
Very nice to meet you, Master. So I'm going to ask you a few questions regarding your health. Is that big fine?
Okay.
How may I help you today?
I'm get bothered with swelling appearing in my groin. It's right here.
Oh, I'm so sorry to hear that. I can understand it's very frustrating for you. But can you please tell me a little bit more? When did you first notice this?
It started, I think, from first time 8 months ago.
And is it growing slowly or rapidly?
I think it was as size of olive, but now it's increasing inside over this last period.
Can you please point out where is the exact site of the swelling?
The swelling is right here that I am pointing now.
Okay, and do you have any other part of the body does have a same type of swelling?
In another part of my body? No.
Yeah. Okay, good. So, is there any history of a trauma or any injection at the groin region recently?
No, I never use injections.
Anything that makes the swelling increase or reduce?
Yes, this is. I think it's increasing when I lift heavy objects. I am gymnastics, and when I lying down, it's slightly decrease in size.
Okay, and is it painful?
No, but I used to reduce it easily as first, but lately I think it's more slightly discomfortable or slight pain when I get to reduce it.
And have you noticed any pulsatile movement over there?
No,
Any discharge or soreness over there?
no,
Okay, and have you noticed any unintentional weight loss recently?
no,
Any lower limb weakness and abnormal sensation?
no.
Okay, great. And you mentioned that when you lie down, the size is reduced, right? And have you noticed that the size of this swelling is increased when you are coughing up or during passing the stool?
Yes,
And do you have any history, prolonged history of a constipation or cough?
yes. For that, I take some medications.
Which medication? Can you please tell me?
I can't remember that, but it's like a drink.
Okay, right. So, are you suffering from any medical condition or visiting to any GP?
No, but I have some problems with my waterworks, some infections there.
Okay, I'm so sorry to hear that. And can you please elaborate a little bit more? What kind of problem do you have in your water works?
I use bacteria, I think, or infection in my waterwork just it.
Okay, and have you gone through any surgery before?
I removed my appendix when I am teenager.
Okay, and if you don't mind, can I ask you a few personal questions?
No problem.
What do you do for the living?
I am a gym trainer.
Right, and do you smoke?
No,
Do you drink alcohol?
no.
Okay, is there any other family members or close relative does have this type of problem?
No, I can't remember. This is one of my family have the same problem.
Okay, so what do you think? What could be the cause of this swelling?
I read some papers and some videos. I watched some videos on net. That maybe like some of my gut get through this hole, something like that. Is it correct?
It's early on to say, but it could be. So I will definitely do the examination and we will also perform some investigation. Then I will let you know. Okay, so for what you are most concerned about?
I'm concerned about surgery. I'm very afraid. So when I remove the appendix, I go some problems after that. I just don't like any surgeries.
Okay, I understand you are concerned, and I'm assure you that you are now in very safe hands. We have a very good senior expert surgeon, so we will try
Okay.
to take care of you.
Can you
So,
please
last question
summarize
I
your
would,
history now?
yes, ma'am. So, by completion of history, I would like to ask the patient expectation. So, I taken the history of a young patient who has a history of right-sided groin swelling
Yes.
for last 8 months, and it was increasing by taking the weightlifting
Yes.
and by coughing and by constipation, and it is reducible. But recently there is some difficulty in reducing the swelling.
Yes.
And
So what are your provisional and differential diagnosis for him?
provisional diagnosis, most probably it has inguinal hernia.
Yes.
And the other differential diagnosis could be the femoral hernia,
Yes.
or it could be the lymph node enlargement like a lymphoma,
Yes.
and pseudo-femoral pseudoaneurysm.
All right. How would you confirm your diagnosis? What investigations would you ask for?
After the completing my history, I would like to go for the clinical examination.
Yes.
And then I will perform some investigation. Like a patient does have a history of urinary infection, so I would like to go for the urine DR and urine CS, and hematological workup like a complete blood count, ESR, and CRP. And if I need for Doppler ultrasound, so I will also go for Doppler ultrasound.
When do you think after surgery patient would be, how would you manage the patient? Sorry.
So if the patient has inguinal hernia,
Yes.
so I will sit with the patient and counseling regarding the treatment of the hernia. So the treatment of hernia is surgery. So I would like to perform the surgery on the patient.
All right.
So it's called hernioplasty with the
Yes.
mesh.
All right. Can you tell me when would be patient fit to go back to work as a gym trainer after your surgical procedure?
Yes, ma'am.
When should the patient go back to work? Yes, in few weeks. Answer is few weeks. Patient was taking stamina tonic what does it, what are the ingredients of it? Does it contain steroid? Yes, are you there? Can you hear me? What
Yes,
are
I'm
the
sorry.
what are the
Yes.
ingredients of stamina tonic? Does it contain a steroid?
Sorry, ma'am, I can't get you.
Yes, a patient was taking stamina tonics. What are the
Yes.
ingredients of this? Does it contain steroid?
Yes, it can contain steroid.
But you're not sure. Okay. Patient had a history of genitourinary infection.
Yes.
Yes. In your management that you told me, what did you think of that? Because you didn't, in the management, you didn't tell me anything about this. Should you send the patient to
Yes, if the
what are GUM
patient
clinics?
does,
Yes. GUM,
yes,
what are the GUM clinics?
the patient does have this urinary incontinence or an infection, as he told me that he might have burning in the maturation.
Yes.
So I would like to go for urine DR and CS to see any bacteria in the urine sample, and if it is a present, so I would like to refer patient and take opinion from the urologist as well. And then I will manage accordingly. I can start the antibiotics for that.
Okay. Good. Did you ask about the travel history?
No, ma'am.
Yes. Travel history is important, and at the end, because patient is given quite a lot of symptoms, so at the end you could have asked the patient to, if patient has, or you should refer the patient to the genitourinary clinic, which is called the GUM clinic, and do the HIV test to rule out if patient is suffering,
Right.
God forbid, with the HIV. So that was one point important.